Hello everyone, I am Dr. Abhinaya Alluri, consultant obstetrician, gynecologist and laparoscopic surgeon at Care Hospitals, Hitech City. Today I am going to talk about menopause. So what is menopause? If your periods have completely stopped for the last 12 months, then we state that you have attained menopause. Now, have you been thinking that your periods have stopped and you can lead a hassle-free life? That's not completely true, because with this there is lack of estrogen in your bodies and you are going to face some complications. Now firstly, let us discuss what are the symptoms of menopause. So firstly, you can have irregular cycles. It can also further lead to stoppage of cycles. Then there is vaginal dryness, there are chills, there are sleep disturbances, decrease in sexual interest, loss of libido, and lot of mood changes happening with this. Now, what are the complications that can happen during your menopausal period? So, as I have discussed all the symptoms of the menopause, and this is because the estrogen supply is gone in your body and the protective effect of estrogen is gone, and it can lead to these complications. The most important being the increased risk of heart attack or cardiovascular diseases. So estrogen has a protective effect on your blood vessels and it decreases your risk of having heart attacks until your periods are there. But once your periods stop, this protective effect is gone and there is increased risk of cardiovascular diseases after you attain menopause and osteoporosis. So there is decrease in the strength of your bones, which can increase the risk of having fractures, mainly the femur and spine. And also lack of estrogen decreases your sexual interest and there is loss of libido and urinary incontinence. The strength in the pelvic floor muscles is lost and there is the chance that you can have urinary incontinence, that is you can leak urine when you cough, or there can be urge incontinence, that is you are not able to stop urine before you reach the washroom. Along with this, you can also have depression or a state of anxiety or panic attacks. All these are due to the effect of lack of estrogen in your body. Now, how does menopause happen? So it can be natural, that is there is decrease in reproductive hormones in your body, or sometimes it can be surgical. Maybe the ovaries get removed during any surgical procedure that's happening, that is called bilateral oophorectomy or ovariectomy. And also sometimes when you go any chemotherapy or radiotherapy, the function of the ovaries is also lost. And sometimes there can be premature menopause, that is before the age of 35 or 40 years only your ovaries stop functioning and you can attain menopause. Now, how is this menopause diagnosed? So as I told you, it is mostly clinical. So when you don't have periods for a total of 12 months, then we state that you attain the stage of menopause. Or sometimes doctor may also order a follicle stimulating hormone test or a thyroid stimulating hormone test to confirm whether you have actually attained menopause or if you have any thyroid problems which is mimicking as menopause. Now, how is menopause managed? So it depends upon the symptoms you are facing. So if you face any of these problems like which we have discussed above, please reach out to your doctor. Don't think that this is a normal process of aging and you have to live with it. So the main thing of this lecture today is that we want to tell you what are the symptoms of menopause and these can be managed. So if you are having, and the most common symptom I forgot to tell previously, or sometimes you can face hot flashes, that is you feel sudden heat in your body which is followed by sweating. This is because of the fluctuating hormone levels and lack of estrogen in your body. So when you are facing hot flashes, you can try natural measures like wearing some cool cotton clothing, layers of clothing, and also if it's not helping you, your doctor even can start you on hormonal therapy to prevent this. And also when you are having urinary incontinence, please start off and do your Kegels exercises. So in this way, you can increase the strength of your muscle, or also we have certain chairs called MCella which can help you in doing these Kegels exercises and help prevent this leakage of urine. And when you're having mood changes, hormonal therapy plays an important role in avoiding them. And osteoporosis, if you have any increased tendency of fractures, you can get your bone mineral density done, and accordingly doctor can start you on bisphosphonates or calcium supplements which can help in preventing the fractures. So please make sure that if you have any of these symptoms, reach out to your doctor so they can start you on hormonal therapy and give you some reassurance and also help you through the process of menopause or aging. Thank you.